you guys know who's who, but I'll just do a quick intro in any case. We've got, tonight we're here from the director of this medical center, Dr. Beverly Good. Yay! And as many of you know, Dr. Good has been in practice for over 40 years, the last 25 of which in particular she's been focused on, I think the words for it have changed, but on integrative medicine. You hear it was called holistic medicine, it's called integrative medicine. I think I've known her for about 20 years, and in that time, the name of it may have changed, but I think the philosophical underpinnings of her practice have not, which is looking at the whole person instead of looking at, a symptom or one part of you. And she's always been very, very big, and I think ahead of her time at that time on nutritional principles and how you look at nutrition and lifestyle and how you bring that all together. So that's definitely a passion of hers. We're also going to hear from Sandy Britt, who I'm sure, yay, Sandy. Sandy is our nurse practitioner. She also has a wealth of clinical experience over 25 years, with 10 of which as a nurse practitioner. Sandy is also really well versed in and has some certifications specifically in bioidentical hormones, which she'll talk about later, and some of the other, she has a real interest in sort of the anti-aging type of area of care as well. And then me, who I don't think I've met a lot of you before. So my name is Sharon Price. I have a master's in nutrition. Like I said, I've known Dr. Good a very long time and Sandy as well. So it was a real natural fit for me to come join this group of women, particularly since my lens is really looking at things through, well, how do we specifically use nutrition and lifestyle, and how can we integrate that with the already very holistic advice that Dr. Good and Sandy give. So that's who you'll be hearing from tonight, and just a little bit on what we're going to cover. So hormones, we're going to start with, well, which ones are we talking about? What are they and what do they do? And then we'll get into the fun stuff, like what disrupts them, what are some of the conditions that can result, and there's a whole host of them beyond some of the ones that I think are near and dear to all of our hearts. And then we're going to get to, okay, so here's sort of the situation. What can you do about that? And as you might expect, we're going to give kind of the whole spectrum of things. So there are nutritional things you can do right away, lifestyle things. Sandy's going to talk about some of the other therapies you can use, and we're going to kind of give you hopefully a good picture of the different options for those. And then lastly, if you guys have questions and can hold on to them until the end, we want to spend a good bit of time going through your questions. So, all right, any burning issues before we get started? Everyone knows where the bathroom is. Okay, and we've all met. So let's see, with that, I'm going to go ahead then and hand it over to Dr. Good, and she's going to kick us off. We have a new lavalier mic, this cute little pom-pom thing.
Yes,
so
it is sort of cute, isn't it?
The pom-pom is stuck on my jacket.
We have a fuzzy microphone. So most of you know me, I think. There's a few faces that I haven't seen before, so thank you so much for coming out. We were worried that, because of the hurricane coming, that we weren't going to, have anybody come, but we were wrong, so we're pretty much full, so we appreciate you coming. So most of you know what hormones are, but I'm going to clarify that a little bit more. So hormones are basically directors. They tell your body to do things. Okay, so they attach to receptor sites. So your thyroid hormones, as most of you know, are responsible for metabolic rate. What speed is our system going to run? Okay, so how quickly or how slowly is it going to run? Our adrenal glands respond to stress and inflammation, fight or flight. And we have sleep hormones. People know about melatonin, et cetera. And of course, we have sex hormones. So today we're focusing on the sex hormones. The thyroid hormones are a whole different lecture. And the female hormones include things like estrogens, more than one estrogen, and progesterone, and of course male hormones like testosterone and DHEA. And don't panic, it's not as hard as it looks. Do you have I'll take that, there we go. Okay, so I'm gonna start from the top down, and I think it's really important, here it is, to note that cholesterol is the base molecule for all of your hormones. So a lot of people get this idea that cholesterol is a bad thing in your system, that it's something that we want to suppress and we want to diminish. and we want to get it as low as possible. But what happens to your hormones if you don't have any cholesterol? You can't make them, right? Okay, so cholesterol is also a building block for the cell membranes of all your cells. So cholesterol is a critical piece of your body's structure. Your brain is 60% fat by dry weight, much of that being cholesterol. So you have to have cholesterol. You don't want to diminish it too low with a cholesterol-lowering drug, because you're not going to be able to make your hormones. So we have the cholesterol as our base molecule. It's also the base molecule for vitamin D, which is also a hormone. And of course, we have our corticosteroids, our cortisone, DHEA, this is androstenedione, which is a precursor to testosterone, and our estrogens. Okay, so our estrogens are broken down into 3 groups. We have 2, the 4, and the 16. And the focus of the research has been on those 3 because they have found that the 2-hydroxyestrone may be a protective type of estrogen in terms of like breast cancer and other disorders. Whereas the 4-hydroxyestrone is potentially a damaging estrone that causes oxidation, kind of like a chemical or a metal in a bad way. It's an oxidized estrogen, as well as possibly the 16-alpha. Might be damaging or it might be more neutral. And then estrogen and estradiol can go back and forth in terms of its structure. And then, of course, if you get a lot of testosterone, that can turn into estrogen as well. And then DHT is a breakdown product of testosterone that's undesirable, makes your husband's hair fall out and prostate enlarge, and that's just not fun. Can you all hear me, by the way? Yeah? Okay, great. Okay. I always did have a loud voice, so. All right. So we have the progesterone level. Progesterone is that happy hormone, like when you're pregnant and you're glowing, progest, for gestation, right? So if you break the word down, pro means for, gest means gestation. So you have tons of that when you're pregnant. It's super, super high. And that is what makes you feel good. It also does a lot of good things otherwise in that it actually reduces water retention. It helps you with sleep. It's a precursor to other hormones. Remember, that was towards the top of our diagram. And it can actually improve your mood. I had one patient who threw away her Prozac after getting on progesterone. Not that I would recommend that, to just do that willy-nilly, but she said, I don't need this, I feel great. I'm like, okay. The estrogens, remember, there's the good and the bad kind. They reduce the breakdown of bone. So in terms of bone, the progesterone and the testosterone help promote bone growth. The estrogen reduces the bone breakdown. Okay, just to kind of make that clear. The estrogens also can assist with cholesterol metabolism. They help with your memory. Obviously, if you don't have enough, you get dry and you get hot flashes and all those goodies, and recurrent urinary tract infections. Testosterone, even though we're women, we all have testosterone. That helps with muscle, connective tissue, bone, right? Super important. It helps with your libido, and it also can have a positive effect on your cholesterol reading. Why would it help cholesterol? I'm just going to divert just a second. It's going to drive her crazy, but that's okay. So cholesterol lowers when your body has less repair work to do, and conversely, cholesterol elevates when it has more repair work to do. So if you have adequate testosterone and it's helping you build things and getting things repaired, right? You don't need as much cholesterol because you've used the cholesterol, you've gotten the repair work done, and the body says, oh, we've gotten that done. Now we don't need as much circulating cholesterol. Did y'all kind of get that? I know this is not a lecture on cardiovascular health, but I just wanted to bring this in about how that kind of ties into this and why it does that. And then DHEA is kind of a precursor hormone, but it also has some independent effects on the immune system and can also help in the reduction of body fat. So, you know, a lot of you guys are really tired of hearing me talk about this, but I'm doing it again. And I have, again, I always say I'm getting up my soapbox about this, but I've been a physician, like she said, it's probably only about 39 years, but it's okay. I mean, who's counting? I rounded up. You rounded up. Great, make me older. So I've been seeing the population change over the years that I've been seeing. So I've been around long enough to see every decade a change in what's happening with my patient populations. And we don't see lots of kids here, but we do see kids. When I was in a standard family practice many years ago, I saw lots and lots of kids. And now we see just kind of I would say a mild to moderate amount of kids. I didn't want to make it an all pediatric practice. But really the kids are showing the worst of it, because they're smaller, right? You know, they're getting affected in utero, and they're getting affected as small children, and so they're more affected by all these environmental chemicals than we are as adults who maybe were exposed to a little bit less when we were growing up, or less in utero. So these endocrine disruptors are horrible. They can mimic your own hormones. They can alter your hormones, and they're similar. Many of them are similar in structure, especially to estrogens. So you end up with a feminization, actually, of your male population in a way that you wouldn't want. And they can directly damage your binder receptors or target cells, etc. So here I'm just going to go through a few. And I wrote to Sharon last night or this morning. I was like, do you think we could add another chemical? And she's like, can you change one more slide? And she's like, I think we're done with the slides. And I said, okay, well, maybe I'll talk about it a little bit, because it is germane to North Carolina, and it's really just come to my attention more so than it had, because I didn't realize it was as bad as it was. And I think I'll talk about that right now, because I do have it in my head. So many of you have heard about the Gen X. Well, unfortunately, it's here now. Yeah, so somebody, I'm waiting for it to come through, said that a woman in Apex had her water tested, and she had PFAS. They're floral alkyls. They're, anyway, that's how you look them up, PFAS, and if you just go to EPA, the EPA website and look it up, you can see. But they are endocrine disruptors, they cause cancer, and they are in our water supply, and probably most of Raleigh as well, because I talked to the water guy, the guy who puts in water systems, who's having this testing done for a number of his customers, and he says it's in the lakes like Jordan Lake and other ones that feed our water supply. So that's a really big concern, because it is a really toxic substance, and it's, like I say, it's germane to us in our area right now. Because, all of us are like, well, maybe it's just Wilmington that got it. It's just those few 100,000 people over there, but it's us as well. So I think, I don't know if it's just this whole half the state or more than that, but it's pretty pervasive right now, and it's a big concern. And it's something that comes from the production of things like Teflon. So DuPont was involved with one of the branches of DuPont was involved with this, and I don't have as much detail about it as I would like some of the other chemicals I do, but it's something I just started looking into, I wanted to talk about. Bisphenol A, a lot of people are familiar with BPA, and you'll see on cans, get BPA-free cans, and I highly encourage that. They do cause increased rates of hormone-related cancers, birth defects, changes in the reproductive tract, and of course early puberty. PCBs, those are polychlorinated biphenyls, and those are in plastics, electrical fluids, etc. They just get into the environment, they get into the food supply and the water supply, and as you can see, it can affect the neurological system. The perchlorates are in rocket fuel or even just regular jet fuel, so there's always kind of like, thousands of flights go over all the time, and it's something that is also affects our water system, and they can block the iodine, prevent thyroid problem, hormone synthesis, and can affect the fetal nervous system. But they're also considered endocrine disruptors. Dioxins and furans. So they did a study in the mid-1980s called the National Adipose Tissue Survey, and in that survey, they looked through all the contiguous United States at cadavers and post-surgical samples of fatty tissue. They measured for about 105 chemicals. They found 100% of chemicals had, 100% of samples, had chemicals, and all of them had dioxin. Mm-hmm. So that was in the mid-80s. So it's obviously worse now. So products of combustion, pesticides, herbicides, you're all going to be depressed when I'm done. I'm sorry. I can't help it. I think really my purpose is to raise awareness so that, you know, people might be motivated to do something about it, figure out ways to protect themselves as much as possible, and to do something. You know, I always tell my patients, whatever side of the political fence you're on, call your congressman, senator, and say, hey, you know, time for you guys to clean up the water and the air and our food supply. We're tired of, you know, us and our families being sick because of this. Okay, and so we have the dioxin-furans. They store in fatty tissue. So most of these chemicals I'm talking about do store in your body, and mostly body fat, but also just in your body tissues. Some of them like the brain, so that's even worse. We have brominated flame retardants, and those are used for furniture, comforters, pillows, plastics, paints, electrical equipment, styrofoam, and affects the nervous, reproductive, and endocrine systems. And then parabens, a lot of people know about paraben, and they look for the label paraben-free, and I think that's a really good idea because those disrupt estrogen receptors, and they cause estrogenic effects. Check your personal care products. You know, shampoos, creams, lotions, conditioners, whatever you put on your skin and in your mouth, maybe your toothpaste. Phthalates. So phthalates are plastics, and we're all using plastic, right? Plastic, those soft plastic water bottles, those are probably one of the worst. And then plastic bags and saran wrap. So you never want to wrap your food in plastic, and you never want to put plastic in the microwave because that's going to pull more of these phthalates out of those containers and wraps and into your food. So what do phthalates do? They mimic estrogen. They bind to estrogen receptors. They can interfere with treatment for breast cancer because they do have these estrogenic effects. They did a study a number of years ago, probably about 7, 8 years ago, where they measured the level of phthalates in women who were pregnant with baby boys. And the women who had the highest levels of phthalates in their urine during pregnancy, their baby boys were born with shorter penises and a shorter anogenital distance. And now that distance denotes maleness. So basically they were structurally feminized compared to the women who didn't have as many phthalates in their urine. So that's pretty disconcerting that we're feminizing our male population with these estrogenic endocrine disruptors. And then there's DDT. A lot of people remember that truck coming down the street with the fog, and a lot of kids went out there running after it, and yeah, not good. There also is some, we didn't put it on here, but there's also been some links to that and cancer. And then, of course, heavy metals. I miss my seafood. Because the mercury levels are so high. And of course, it causes decreased sperm count. Testosterone levels can affect ovarian function. And of course, we breathe those as well. One of my wonderful patients, who's here, I'm going to just say she's here, and she was able to get me an emissions report from one of the coal burning plants in North Carolina, and it showed that there was antimony, arsenic, lead, mercury, a bunch of other metals in the air, along with over 5,000 pounds of cyanide every year going into the air. So we're not just drinking this in the water or eating it in our food, we're getting it by breathing it in, which is pretty scary. So you want to try to minimize your exposure. Sorry, guys. They still exist. But do the best you can. Eating organic helps, et cetera. And Sharon's going to have some more things to say about that later. Okay, so this is I call it the cancer slide because that's kind of what everybody's like, oh, well, what about cancer? Well, yes. So I think we ought to talk about cancer, and especially cancer and hormones. So what causes cancer? Well, first of all, you can see up here we have all these endocrine disruptors, and we have other chemicals that are not strictly labeled as endocrine disruptors that can affect your system, like some of the, like things like the benzenes and some of the other gaseous type of things that we are exposed to. But in any case, we have all those endocrine disruptors that I spoke about, and those have to be metabolized by the liver. So the liver takes these chemicals and it breaks these chemicals into pieces, and it kind of wraps them up and it gets rid of them, and that's what it's supposed to do. And the way that it does that is it utilizes vitamins, minerals, and amino acids. So I've been using vitamins, minerals, and amino acids with my patients for, I think I'm at 27 years on that one now. I think you got the years, you know.
I just talked about my personal life.
Anyway, so what's the problem? Well, first of all, as you all know, and she's going to talk about, it's not as much nutrients in the food as there used to be, but the demand for vitamins, minerals, and amino acids, and especially antioxidants, okay, because we're trying to combat all these things all the time, has gone up more than exponentially. So, I mean, how much, you know, the amount of vitamin C that my patients need keeps going up and up and up and up because the body is trying to neutralize the effects of all these oxidative processes that are occurred by all these things. So oxidation basically is just like rusting, all right? And so we all have oxidation as a normal part of our system, but then it becomes amplified a lot by all those chemicals and metals we were talking about. So when you have all this oxidation, what do you need? You need antioxidants, things against oxidation that are going to neutralize the effects of the oxidative processes that are abnormal that are going on. And then, so what happens is, now we've got some damage to our DNA. Okay, and then we throw in some bad estrogen, which is also an oxidizing agent, because it's been oxidized, and now it becomes an oxidizing agent to cause further damage, especially to, in this case, cells that would be estrogen receptor positive, right? And now we have a cancer cell. Just throw a little stress in there too. And then all is not lost, so no panicking. You can avoid this. So the way that you avoid this is your natural killer cell. So an NK cell means natural killer cell, and natural killer cells are normal everyday cells that we have that go around and gobble up and kill cancer cells. So everybody has cancer cells here and there. It's when your natural killer cells are no longer able to handle the cancer cells that are there that you get into trouble. And so they are protective if you have enough of them, sufficient number of them, and if they're functioning properly. Now, what will interfere with their function? If you're having a lot of allergy and your immune resources are here rather than here, if you're low in antioxidants, and then of course the toxins I was talking about, especially heavy metals, but other toxins can interfere with your white cell function. So if we do this cleanup, and she's going to talk more about that later, and then you get your antioxidants on board, you can reduce your risk and chance of cancer. Hormonal imbalances. All right. So there's a whole list of things and conditions that can exhibit as hormonal imbalance. Everybody's familiar probably with premenstrual syndrome, PCOS, endometriosis, infertility. We're seeing lots more infertility than we ever did. Menopause, perimenopause, and andropause for the guys. We won't leave them totally out. And then if we go, she's trying to change the slide here. Okay, so this is a normal female cycle, and don't worry, I'm going to go right through it. So day one, right over here, is the first day of your period. And so now you're sloughing off your lining, okay? And you can see your progesterone is low. And then as estrogen levels start to rise, this lining thickens and grows, okay? You ovulate here, around here, and then your progesterone levels come along and they stop and organize this lining. Okay, so that's a normal cycle. So in premenstrual syndrome, you can have a problem because you have too much estrogen, or you have too much of the bad estrogen because the bad estrogens are more potent than the good estrogens, okay? Or you can have inadequate progesterone, or both, right? And that's going to cause all these symptoms that y'all are pretty familiar with. I won't go through that. Okay, and now more and more we're seeing, and especially in this in relationship, not to just the perimenopause, because you see this a lot in perimenopause and before you go through menopause, but also we see this more and more now in our patients that are having fertility issues, where we have our regular, our normal estrogen levels. What happened to the, oh, okay. Yeah, just, you're moving. I'm like, my screen is moving. Okay. We have our estrogen levels, and then our progesterone, though, is not, our progesterone output is not adequate. So instead of it being up here like it's supposed to, it's diminished. And when it's diminished, actually you get an increase in an organized growth of this lining that can lead to heavy bleeding and clotting and more PMS and a lot of discomfort as well. Some women have too much estrogen, all right, due to excess production, or maybe their liver isn't clearing it if you're drinking alcohol, which you all know I don't recommend. But if it can impair your liver's ability to metabolize estrogen out like it's supposed to, you know, because your body's supposed to keep a balance of it. And so the estrogen, you get too much estrogen hanging around either because of excess production, the poor liver clearance, or again, too much of the bad estrogen. And even though our progesterone levels may be okay, the estrogen's too much, and again, you'll end up with the same situation. Well, this will thicken too much, it'll be irregular, and you could end up with all those other symptoms I was talking about. And then here's some nice technical names of all the different things that can happen. You can have pain with your periods, excessive flow, short cycles, etc. Polycystic ovarian syndrome, you can have multiple cysts in the ovaries. Sometimes you just get these sacs with membranous linings that fill up with fluid, which are basically cysts, and these can interfere with ovulation. Though there are some women who get the symptoms of polycystic ovarian syndrome without actually getting the cysts. It's kind of a newer thing we've been seeing in the last, I don't know, 5 or 10 years. It increases your risk for infertility, bleeding, cancer, metabolic syndrome. We do, generally there's weight gain, but we have seen some women who are not overweight who have this. But when you do their blood tests and stuff, you can see that they do have insulin resistance. Their hemoglobin A1C, fasting insulin, et cetera, will be elevated, or their insulin resistance scores will be high. And then they can have these other symptoms as well. And I think, you know, they think that with PCOS there might be a little bit of a genetic predisposition towards it. But even so, we've helped some women with PCOS, you know, become pregnant and maintain a pregnancy. But the mainstay really is just staying away from sugar in those cases and working on getting their nutrition up. Endometriosis, there's a lining that resides inside the uterus. As everybody knows, that's the endometrium. That's that lining I've been talking about. And when it grows outside of it, so how does it get outside? Well, we don't have an anatomy slide, but basically you have the uterus, and then you have the fallopian tubes. And they're actually open a little bit at the ends, and they just have these things that grab the eggs as they're discharged. And so the endometrial lining can escape out of there and get into the abdomen. And then they implant on things like your uterus or your bladder, and they can cause a lot of pain and discomfort. But just like balancing any other hormones, if somebody doesn't have a severe, they have a mild to moderate case of endometriosis, you can often treat it just by helping balance their hormones and getting that endometrial lining to do what it's supposed to do. If it's severe, sometimes they do have to have those implants surgically removed. But that can cause a lot of misery. Infertility, we talked a little bit about that. You can have problems with ovulation, the blocked fallopian tubes. So these would be more like structural issues. For us, we don't really work with those. We work more with the other problems, like the problems of ovulation and the hormone imbalances. But if there's structural problems, those need to be taken care of. Other factors are age, stress, poor diet, over-exercise, being too overweight or too underweight, smoking, alcohol, STDs, and then, of course, health problems that cause hormonal changes, and, of course, my favorite friend, the endocrine disruptors, right? Perimenopause. So I've been seeing, like it says here, we've been seeing perimenopause come earlier now, from late 30s up to about 50 or so. We never used to see anybody younger than 45 or 50 with perimenopause, but now we're seeing gals in their mid to late 30s. And again, I do believe it's because of the endocrine disruptors. Some women have PMS half the time, not fun. And again, it's because of those anovulatory or luteal phase defects where you don't get enough progesterone that latter half to balance all the estrogen, so it can make you feel pretty miserable. And then you can get pretty intense PMS, heavy bleeding, and it can kind of go up and down and up and down. It can be really uncomfortable. But again, the healthier you are, and that's the anovulatory cycle where you don't ovulate at all, so there's no ovulation, progesterone stays flat, and all you have is just this unopposed, they call it unopposed estrogen. So you have lots of estrogen, not enough progesterone, so you get really a much, much more increased growth of this lining here. And that's when you get a lot of heavy bleeding and clotting and et cetera. In menopause, if you haven't had a cycle for a year, so there are some lucky women who just breeze through this and have zero symptoms. I'm just telling you, not everybody has menopausal symptoms, but a lot of people do. And we can help women with those. We have a lot of different techniques for that, which Sandy's going to talk about. Sometimes adding, small doses of hormones can really help. Sometimes we use some herbals. Sometimes we use just some other nutrients that can really help with the dryness and some of the other symptoms that you can get. Andropause, yeah, what about the guys? So we were seeing more and more of that as well. A lot of the male patients we see have hormonal changes, and they get a decline in testosterone. Even some of the younger guys, like in their 30s, are getting it. The problem is with traditional treatment, they'll give these big doses of testosterone and shut them down. They can even get atrophy of the testicles, and we don't want to do that. Just getting guys healthy, reducing their endocrine disruptors, cleaning them up, getting them healthier. We've had a lot of gentlemen whose testosterone levels have doubled just after 3 to 6 months of just working on their overall health. So the healthier they are, the more testosterone they're gonna make, right? Because what does testosterone do again? Muscle, connective tissue, bone, right? Okay, so if the body is stressed out, either from inflammation or allergies or sugar or whatever, okay, if the system's stressed, the body says, hey man, I'm just treading water here, don't ask me to build anything, and testosterone levels drop. And then, of course, if the system's polluted with lots of chemicals that disrupt the testicular ability to make testosterone, that's an issue as well. So we kind of go on a cleanup and repair mission, I call it, and lots of these guys get better. And sometimes they do great, and other times we just give them a tiny bit, like a little supportive dose, and they're just fine. And they can have lots of they can be really grumpy. So really, they can have all these symptoms, and these men are really, I'm not really joking, but they can be really unhappy, and it's really sad because a lot of these men were very vital, and some of them are even athletic, which is interesting because exercise actually increases testosterone levels, but because of all those other factors we were talking about, they can actually get a diminished level of testosterone. And it really causes lots of trouble, as you can see. Erectile dysfunction, low libido, increased cardiovascular disease, that's what that means. Of course, they can't make muscle like they used to, so that's always a good question I ask the gentleman. Is it harder to make muscle than it used to be with your workouts? And a lot of them will say, yeah, I mean, I'm working out the same amount, and I feel like, my muscle mass is going down, and they know it. They know it. Even the guys who exercise. And then they can get bone loss. So that's one of those things, decades ago, I never saw a guy with bone loss. You never saw a gentleman who didn't have great bones. And now we're seeing guys with osteopenia and osteoporosis. It's like a new thing.